And your donations will go directly to the Malloy Strong Fund at Rhode Island Hospital.
The fund helps patients dealing with the financial hardships of undergoing cancer treatment. Mario Hilario introduces us to one such patient.
With a strong history of breast cancer on both sides of her family, it was never a matter of if, but when Michelle Ray would get the disease. But thanks to her treatment at the Lifespan Cancer Institute, today she is cancer-free, and she joins us now, along with her oncologist, Dr. Stephanie Graff. Thank you both for coming in.
Thank you.
So when did you get the diagnosis, and what was your initial reaction?
I got the diagnosis the end of March 28 of 2022, and it was, unfortunately, it happened, but it wasn't a surprise due to my family history. When I did find out that that's what it was, I went to meet with Dr. Graff, and she was very supportive on that day.
Yeah, and tell us about her diagnosis. It's triple negative. What does that mean?
Yeah, so Michelle has triple negative breast cancer. When we classify breast cancers, we either think of them as being positive for hormones, estrogen receptor or progesterone receptor. That's one type of breast cancer. Or you can have a HER2 positive breast cancer, which is another type of breast cancer. And then the third type is what we call triple negative, where you're negative for estrogen, progesterone, and HER2. Often we consider triple negative breast cancer, Michelle's type, to be one of the more aggressive types of breast cancer. It almost always needs chemotherapy for treatment.
Yeah, and knowing your family history, you were regularly checking, right?
Yes,
every
year for many, many years now. Since I was about 25 years old, I would go to the Papa Center and get checked regularly with ultrasound and mammogram as well.
Yeah, and then you felt?
I did. It was one of those things where I was like, what's this? And then it was like, it's not getting any smaller. Maybe I should have it checked out. And therefore I made the call to my gynecologist at the time to schedule to see her and get the referral back to Papa's for what they call a diagnostic mammogram.
Yeah, because you know your body.
Correct.
Obviously. And it's important, even though she was regularly getting checked and having good results, to keep on top of it, right, Dr. Graff?
Yeah, absolutely. I think anytime somebody feels a change, even if they've had a mammogram, that they do exactly what Michelle did, which is call and ask for additional assessment with their gynecologist, their primary care physician, a breast surgeon. So Michelle is an all-star patient doing exactly what you're supposed to do. I would also just say that, you know, Michelle does have a family history, which is obviously a risk factor for developing breast cancer, but most breast cancer is not genetically mediated. Michelle does not have a genetic mutation, even though it runs in her family. 1 in 8 women will get breast cancer in their lifetime, and even people that have a family history, their risk goes up, but it's still about 1 in 5 women with a family history will get breast cancer. So knowing your family history, understanding how it affects your risk is important and something that we should all be talking about.
So when she got the diagnosis, what was the best course of treatment from your perspective for her?
So Michelle got chemotherapy and immunotherapy before surgery. We call that neoadjuvant treatment to try to shrink the tumor as best as we could before surgery, and then got surgery with Dr. Graves. And do you want to tell a little bit about your experience with Dr. Graves?
Yes, so Dr. Teresa Graves is part of the Cancer Center. She was one of the founders of that more than 20 years ago. I know that personally because my mom already had breast cancer over 20 years ago, and that was also her surgeon. So I kind of already had a connection with Dr. Graves to begin with, going that far back. So I knew exactly who my surgeon was going to be, which was her. And it's ironic because it's the same facility that I would take my mom to for her treatments, and then here I was, almost in my mom's seat kind of a thing with Dr. Graves as well.
Was that comforting and made you feel better?
Yes, and she's phenomenal as well.
Yeah,
yes.
So obviously your mom is a survivor.
Yes.
And to go to the same surgeon that she went to.
It's very ironic, but it was great because I already knew how she was.
Yeah.
Yes.
Did you ever think about like going out of state, going to another place?
Never crossed my mind, ever.
Why?
I just felt like this is a place where it's in my backyard. It's nowhere far. I know what I'll be getting per my mom and everything else. I've always heard great stories about it. And then seeing Dr. Graff for the first time, we just clicked. I'm like, oh, she's great. I never even thought about anything else but going there. And it's ironic because I was asked, oh, do you want to go out of state? And I said, I didn't even think of that, but why would I want to? No. But thanks for asking me if I was. I said, no, I'm okay with where I'm at. Lifespan Cancer Institute is where I would want to be, and this is where I'm going to go. and it's where I'm going to stay, which I did.
Yeah. And tell us how you're feeling today.
I feel wonderful today considering with what's going on. It's almost been a year now. Cancer-free since October. Diagnosis was back in March, like I said, of 2022. We're already, you know, where we are today. I really can't complain. Treatment's been wonderful. The cancer center's been wonderful as far as when you walk in, the receptionists, the medical assistants, the physicians, the nurses, the volunteers that are there cheering you on. It's phenomenal. This place is just something that I could never say anything bad about or would ever want to, because they're just phenomenal.
If you have to go through this, this is the place where you want to go through it.
Absolutely.
And it's great to see how well you're doing. Michelle Ray, thank you so much. Dr.
Thank
Stephanie
you.
Graf, thank you for your advice, and we hope by sharing your story, we're helping others out there as well.
I hope so as well. Thank you.